This is PI Help with another video. This time we're going to be discussing some medical condition that causes infertility. Well, we're going to be looking at incomparability. Incomparabilities, let's look at it for a little bit. Number one and number two and number three. We're going to be looking at China. There's an incomparability and there's not a parity between males and females. So what happens is the rate of the newborns or the babies actually fall. Then what we had in the Amazon, a tribal war was actually avoided. The reason that the tribal war was avoided because in one particular tribe you had too many females and the other tribe you had too many males. So the plan was to actually capture the females and yes, to make it viable for the tribe where not too many females. So the tribal elders got together from both tribes, and what happened is there was an exchange between males and the females between the two tribes. So what happened? The tribal war was actually avoided. It was nullified because of the exchange between the males and the females. Now let's look at the Galapagos Islands where you have actually the parakeet fish. The parakeet fish, if there is not enough males, what will happen, the female goes into stress and actually genetically converts into male. Now what happens, it becomes a vibrant and viable male. Now of course in a human species that's not possible. That the female becomes viable male or the male becomes viable female because of the gamete. You still need two different types of gamete. You need a male gamete and a female gamete, but genetically speaking that's not viable in the human species. But there are some individuals that are actually born with both sexes. Yes, there is such a thing genetically, but they are not viable. In other words, the male or a female in this particular case has to choose, because they are born with both sexes, whether or not they're going to become either male or a female, or they chose not to become either a female or male. But in a human species you still need one male and one female gamete. Now the incomparability between the male and the female gametes, under all circumstances, the numbers that is being kicked around in the medical textbook is approximately 10%. Under the circumstances, I think 10% is very, very low. I have a feeling it's somewhere along the line of 15%. A range between comparability between the male and the female and the rejection of the male and the female gamete. Now we come to the thyroid hormones. The thyroid hormone is approximately about 4%. The hypo and hyperthyroid, the TSH, T4 and T3, what happens is affects the sex hormone binding globin. There are some numbers that are being kicked around, TSH and the T4, that is approximately about level 4 on the thyroid, on the blood test. There are some specialists that go all the way down to 3.25. Even 3. There's a conversion problem between T4 and T3, so that can be problematic. Now we're going to be looking at the sex hormones. The sex hormones actually in the medical textbooks actually is approximately kicked around 28 days between the viability of the sex hormones and when the female becomes into cycle or menstrual cycle. Actually should be done on the second day. The third day is not as good. The third day is, I don't basically like the third day, I like the second day. What is it? The FSH, follicle stimulating hormone, and the LH. That will tell us whether or not the estradiol or the estrogen and the progesterone are in even on on the test. It should be somewhere along the line even. Now, I don't have any days here because I have seen females that it's in 24 and in 36 days the cycle. But I will be getting into this one on the Edison and the adrenal. What happens is I have seen a female that is actually 2.5 months. So that's why I have absolutely no days here. It should be done on a half point of the cycle. That means if the cycle is, we're going to make it up as we go along, let's say 20 days, on a 10-day the E2 and an E1 conversion. Not just only the estradiol, the dominance of the estradiol but in estrol, because the female has 3 different types of hormones, estradiol, estrogen and estrol. So there's a conversion ratio right here, which is very, very important. The other problem also can occur in an ovulatory disorder. Ovulatory disorder is approximately about 25%. We can also have polycystic ovary syndrome also within between ovulatory disorder. That's approximately about 25% of the female population within viability of the childbearing age. Tubular blockage and abnormalities is approximately about 11%. Adhesion, ovary adhesion is approximately about 12%. Now I'm going to stop here for a second. I'm going to mention a couple of things. I was involved as a consultant, one of the female, that actually what happened is had just about all these problems, adhesion all the way up to the thyroid problems. So what happened? One of the tubular blockage and one of the ovaries actually didn't work at all. It was just one of them. The second, they were able to open up the tubes, but what happened is when they harvested the eggs, the adhesion just not occurred. There was none, zero. So actually the medical intervention was all failure, all of it. So all of a sudden, approximately about 6 to 9 months later, she becomes pregnant. Why? Clueless. The term was actually, the pregnancy was carried to terms, 38 weeks, very, very vibrant baby child, now is a child, absolutely healthy, a few little edges here or there, but other than that, he's very, very, very healthy. No clue why that occurred. Absolutely no clue. So we also have endometriosis, which is approximately about 15%. Hyperprolactinemia is approximately about 7%. Now I'm going to stop at the diabetics. Diabetic 1 or 2. Usually in the textbook it's kept around 8%. I think 8%, I think it's low, very, very low. It's approximately, I have a feeling it's somewhere along the line of 15% area. Lupus, I was surprised a little bit on this, on the aspirin side, which is 1 in 1 million. If somebody's taking aspirin on a regular basis, what will happen is that the aspirin will cause lupus, approximately 1 in a million. Black females, especially in certain areas of Africa and including descendants of black Africans, sickle cell anemia. That is not prominent, but it's worthwhile mentioning. Male infertility. Now, male infertility, I will stop here for all of it. We know that testosterone has been falling quite a bit. Sperm count has been falling quite a bit. Gynecomastia, in other words, female-like breast, is actually on the rise quite a bit. I would have to say it's approximately 15% of the male population is dealing with gynecomastia or female-like breast. So I'm just going to call it female-like breast. So what happens? Back in the 19th century, in the medical textbooks, there was only one sentence appeared that there is such a thing as male breast cancer. That was it. And there was no other mention of it. Today, from the 19th century to today, is approximately about 7%, which is quite high. Of all the breast cancers are male, 7%. So gynecomastia or female-like breast, 15% is also very, very high. I was involved in one of the child. The parents asked me for consultation. I said, fine. So the parents brings the child, and I asked the father, I said, do me a favor, just take the shirt off. And I was amazed, I just only made a note. And I was wondering what the heck this child was doing, or eating, or what are the circumstances. 6-year-old, incredibly noticeable female breast in a male child. And I just looked, and I was actually astonished that such a young age, such a developed female breast. So something in our neighborhood of an environment in our neighborhood has to play a major role in that. I have some notion and thoughts on that, but I will, in this particular case, I will not touch upon. Now I'm going to say a few words about young females. Young females usually, because we cover the young males, they usually come into cycle approximately in modern days, as we know in 24, approximately about age 10 and a half, 11 and a half. It's 12 years old also is quite liable, and including all the way up to about age 14. So what happens? The youngest child that actually, because that's what it is, youngest female child, actually became pregnant approximately about 9 and a half, as if I remember correctly from the medical textbooks. But this is where we're going to be covering. The FSLH and the LH and the actual ovulation that it takes place in about halfway of the cycle actually can occur 1 year prior to the cycle. In other words, if a child, young female child, the cycle actually begins, let's say it's very simple to work with, age 12. That means at age 11, ovulation can occur. If it's age 10, that means the cycle begins at age 10. That means 1 year prior to that. That's not always correct, because it up to usually age of 1 year. So that is a somewhat incorrect conceptions in individual's mind. Oh, okay, that the young child, let's say at age 12 becomes, the cycle begins, let's say in 7th grade, let's say 7th grade. So what happens is that's when her cycle begins. No, 1 year prior to that. That is very, very important to understand and to know. That's why in the medical textbook, I think it was 9.5 years old that a child became actually pregnant and showed absolutely no cycle, menstrual cycle. So basically that's the whole thing on that one. Now, hyperplastinemia and Addison disease and adrenal, and I said right here on the cycle, on the male and the female cycle, what happens is that it was 2.5 months. Even if it's 2.5 months, the blood test has to be on a standby. The reason for that even if it's 2.5 months, this has to be confirmed. The LH and the FSLH and estradiol and the progesterone and the E1 and an E2. That has to be actually on a standby basis. But also, to reconfirm that, so that you have comparability, the saliva test must be also done. Stress hormones, the LH, the FSLH, and the E1 and the E2, so that we have actually a comparability of the test, so between the blood test and the saliva. I'm also going to say drugs. Well, I was going to stay away from drugs because we know whether it's a street drugs or a medication that is very, very important, let's say during pregnancy, for one reason or the other. For example, in the case of a diabetic. Now, there is, I wasn't going to mention this, and that's why I scribble here. There is such an animal on the internet that I was actually a little bit surprised on that. What is this animal? It's called Ozempic Baby. The good, the bad, and the ugly. Now, that's why I was not going to touch upon the drugs, because drugs and pregnancy do not mix. And then we also mentionable here, up here in the sickle cell anemia and the lupus, I would like to mention cancer. Yes, cancer patients, even breast cancer patients and the cancers in the patient, yes, they can actually become pregnant or being expecting mother. Let's say if we talk about epileptic seizure, let's say both parents are epileptic. The chances of the child becoming epileptic is approximately about 3%. That's the number that is being kicked around in the medical textbooks and in the literatures. So 3% it is the number of individuals being epileptic patients or cancer patients is becoming prominent, especially in the breast cancer. Can they actually conceive? The answer is yes. I wasn't going to mention leukemia, either childhood leukemia, but yes, that I just mentioned that portion of it. Now let's look at some of the other terminologies that is being kicked around and is being used. One of them is that, as we can see all these numbers up here, some medical condition that causes infertility, we add up all these conditions and we're going to be coming up with approximately about 35% cause of infertility or problematic infertility. 35%, so because of that, we have three different types of a language that can be used. We have what is known as a biblical language, that the female is actually in a blessed stage. The reason for that is in a blessed stage is that pregnancy and causes of infertility is quite high, 35%. So we can, yes, it is a correct terminology that she's in a blessed stage because some females cannot conceive. So that's 35%, that number. So that's a correct terminology. Now, pregnancy is also correct terminology because it's basically a medical terminology. Pregnancy, the simple reason is that it's a burden on a female body. So when they say that it's a burden on a female body, there's also another misconception there that is being said around that you're eating for two. No, you're not eating for two. At best, you're eating 1.5. But that's just a comical little terminology. Oh, you're eating for two. No, 1.5 at best. I don't want to get into the terminologies and the actual calorie counts and all that. No, this is not what it's all about. Then you have what is known as the expecting mother. Expecting mother is usually a terminology that is being used on a day-to-day language. Oh, you're expecting. Oh, you're 12 weeks, 16 weeks, 30 weeks. Usually around 6 months, it's quite a bit. It's showing quite a bit. So he says, well, I mean, the female replies, well, I'm in approximately about 30 weeks. So that is also absolutely correct. Usually they don't say first trimester, second, third, or a fourth trimester. I mean, it's just usually it's not in a day-to-day language of the of the common language. It just does not occur. Oh, I mean third trimester. How many weeks is that? So no, that is actually being excluded. So the terminology is actually being used is actually the number of weeks. So that's basically the whole, and as we can see from these medical conditions and the percentages that is actually occurring, of course you can have some other more percentages, and of course you can have more medical conditions that cause infertility, but I try to mention the major ones. And yes, 35% causes infertility or problematic pregnancy or infertility. And that's quite a bit of a high number. Well, thank you so much, and have yourself a wonderful day, and have a healthy one.